What's up, everyone? Welcome to Beyond the Response, where we intend to share real life stories beyond our lives in emergency medical services. I am Matt, and I'm here with Nick Hanetho. How are you, sir?
I'm doing good, brother. How you doing?
I am fine. I am fine.
Excellent, excellent.
I was talking with Craig, and we were talking about who we could talk to about cumulative stress, leadership, and we also want to kind of branch out to the firefighter side of being a first responder. And I was like, I got the guy. Okay, I got the guy. Let me hit him up. And you said yes instantly.
Hmm.
So thank you for being here, sir.
Yeah, of course, of course. Yeah, glad I could be here.
Um, Nate, you are a Navy corpsman and a firefighter. Could you kind of go into a little bit more detail for the people out there that maybe not too familiar with those jobs?
Yeah, so I'm a United States Navy corpsman, which is basically it's a medic. We don't like to be called medics. That's what they call the guys in the Army. But we serve in naval hospitals, naval clinics, naval ships, with naval commands, and with the United States Marine Corps around the world. Um, I was very fortunate enough to spend a majority of my time with the United States Marine Corps, 24 years total, between active duty and reserve time with 4 deployments in there. Absolutely loved it. I think it was one of the best jobs that I've ever done, still to this day. I retired from the reserves in October of 2022 as a chief in the Navy. So very proud moment making chief in the Navy in 2017. So it was just an awesome thing, and really, really enjoyed it.
Appreciate your service for our country,
Yeah,
sir.
thank you, thank you, thank you.
Were you got into firefighting after that, or was that in the midst of it, or?
In in the midst, so I got off active duty in late 2004 and joined the Hattiesburg Fire Department in South Mississippi. There, where we met for the first time, and was a firefighter there for 10 years. Went to the rank of lieutenant, and then left there, and I've been in Fort Worth, Texas now for 13 years, where I work as a on Truck 14 as a firefighter. And
Okay.
yeah, so that's kind of been the transition in 2004. That's when I went off active duty and joined the reserves and was with reserve units within the Marine Corps after that, all the way till 2022, with a few deployments sprinkled in there also.
Are you strictly doing like quote unquote firefighter stuff, or are you doing medic stuff?
Yes, yes. I'm just an EMT basic now. I ride the back of the truck. We do basic medical care as EMTs here. We have paramedic engine companies. We have paramedics that ride our rigs. We have monitors, equipment, and all that stuff. Here recently, a lot of people realize that know that we took over MedStar, which was the private ambulance service here in Fort Worth, and transitioned to a fire-based EMS, and that was in July. Finally got a lot of those kinks worked out. We're still dealing with some manpower issues, but overall, I think our medical care has gotten exceptionally better here in Fort Worth just because of us taking over that ambulance service.
I've always wondered how I would feel about fire-based EMS in general, because we've thought about moving away from Louisiana, and if you go anywhere else in this country, it's either the small individual private owned companies, or most of the time it's the fire-based EMS. And I'm just like,
Mhm.
I am going to lean towards that. I don't think I would like it. Um, do you have any thoughts on that? Like,
Well,
convince me.
yeah, so I do have some thoughts on it. I mean, and I have to give this, just to let you know this. I am a big component of our union here. I work on our political action board within our firefighter association. So I'm just a big pusher of just, hey, I think people having defined benefits and having a pension, having good health care, not being able to, working for a private company where you can come in and be fired whenever you want. That's kind of my big thing with working for fire departments, because most fire departments are associated with an association or a union or something like that. Some have contracts like we do to where it protects us even more. Man, I think the biggest thing is, yeah, you see there's different there's different places like here where we're not the highest paid ambulance. Obviously, in the DFW Metroplex, we've lost people to smaller departments like Grapevine and some of these other places that pay a little bit more. But I think the fire based and having single role working along with dual role at fire stations, I think you get more of that camaraderie aspect. You're living in a station. You're not sitting in a quick trip parking lot or in a grocery store parking lot in a thunderstorm. You have like, I can just tell you our guys at 14s here in Fort Worth, I think they were the busiest ambulance next to Engine 5. And then it was the ambulances at 5s. I mean, they're running an astronomical amount of calls right now. So they have beds they can come back to. We're cooking their meals for them. They have a bathroom to go to. They're not having to go into a truck stop or something like that. I think those are some of the big benefits because, I mean, I know Acadian, if I remember correctly, Acadian did have stations, right? You guys had some stations. You have stations there, correct?
Yeah, it really depends on what area you're in.
Yeah.
So like our area is strictly, we have stations that we come out of, but
Mhm.
we don't go back to, like, as soon as we get there, we're on the road. We're at the quick
Yeah.
trips, the racetracks and stuff like that.
Yeah, that's how it was when I was with AAA. AAA, we had, I worked there for 5, 6 years, and we had very few posts where we actually had like buildings. I think Pedal, we had one across from
Shout
Force
out.
General, and yeah, we had a very few. So I mean, I didn't enjoy that, and I get it. People with back injuries, you're eating. I mean, hell, we all know. I mean, it's garbage food you're eating from gas stations, and it's not healthy. And that's what I think the big components of fire based EMS is that it brings the EMTs and the paramedics into the stations, and it's more of a family. I mean, I've seen it 100%. We have a lot of folks who are really enjoying it just because not that you're not treated like humans with private ambulance services, but I think they feel like they're more part of a family and part of the department.
I would probably agree with that. I think you bring up a good point here, which is being treated like a human. You get that social interaction with other people. It's not always on the road, and you're able to cook for yourself and stuff like that. I think mental and physical health has a lot to play with it, and it's something that I've personally been working on a little bit more here recently. I'll shout out Megan if she's into watching this, like work-life balance and stuff like that. So I think that plays a huge part into how EMTs, medics, firefighters, whatever, when they come to work, and if you look at me who's leaves the station immediately versus someone like you who stays at the station and gets to build relationships with other people, it's interesting to see, like, it's interesting to contrast both of those lifestyles.
Yeah. Yeah, I think, talking about a work-life balance, and like I know we always try and balance like, hey, let's not bring everything home from the fire station. Same thing with the calls that you gone, not bringing them home to, Christina and the kids and stuff like that. Is that, I I think when we're all together and bringing, coming into fire-based EMS, I don't even like just bringing EMS into the firehouse is we know each other. Like if I come in and Matt, you know me, I'm loud. I'm always, if I'm not who I am and I come into that station, they're like, man, what's going on with this guy? What's wrong with this dude? And it's the same thing with our EMS people now. We're starting to learn them and we know them. So like when they're having a bad day, we're like, hey, sometimes we'll mess with them a little bit, kind of because that's what we do as family. But also we know, hey man, this guy's a little off today. Why don't let's talk about it, let's figure it out.
That's something that doesn't get brought up enough. I think we've been kind of exploring burnout and stress, and we haven't really talked about PTSD a whole lot on this channel yet. But like burnout, mental health, and one thing that kind of always gets brought up in those 2 episodes that we did with Stefan was, noticing someone else noticing you dealing with something before you actually notice it. And I think since we had that discussion, I've been kind of picking some people out and be like, hey, I think you're burned out. I think you are going through something right now. like, let's talk about it. And there's a stigma with all that. I think from when you grew up and even when I grew up, it was we don't really talk about those feelings a whole lot. Especially, I know you probably experienced it more being in the military and whatnot. Um, but there's just like that stigma, like you get this this identity of being weak and whatnot, just
Well,
because you're going through some stuff.
Matt, I use our family for an example. I mean, look at our brothers, Josh and Larry. Look at our sister Michelle, and look at your dad. I mean, when do we ever sit down and talk about our feelings? And all of us are involved in either the military, paramedicine, working on fire trucks, or or nursing with Michelle. I mean, but when was the last time we all talked about our feelings ever?
Never.
I can't. I don't think we have. I mean, but
Never.
and I don't think it's a stigma with us. I just think it's, man. I don't know. Sometimes you feel like I don't know. You know how it is, man. You don't feel like you want to be a burden to your family when you go home and stuff like that. Like, I mean, Christina's got enough going
Yeah.
on raising those kids, man. I mean, you don't. We've got families. I mean, I'm lucky enough. Well, I don't want to say lucky, but my kids are gone. So I've got a dog in Charlotte now. So it's like I can come home and complain to
Yeah.
the dog. It's like not a big deal, but yeah, I think it's one of those things to where noticing people's stuff. I mean, it's sometimes it's hard.
Burden would be, I guess that's what I was kind of thinking in my head, but I couldn't find the words. Burden would be perfect
Yeah.
for what it's like, I think, because people are out there thinking, well, you know what, I don't want. Well, it's also being private and whatnot, not want to voice your feelings and whatnot. But burden would be a huge factor in that, I think.
Mm-hmm. Yeah. Yeah. It's one of those things where, I guess I'm lucky enough to where over the years with the military and being a firefighter for so long now, I've kind of learned how to deal with things. Not gonna lie. I mean, I used to deal with it in ways that we're not supposed to with alcohol and things like that, and we still do that every once in a while, but now it's, man, I don't know what it is. I just let things kind of roll off me. And, you get those certain calls that'll bother you sometimes. But, I think I've done a pretty good job now of, we do a good job of talking about it. We've got a great department that has great critical incident stress debrief teams that'll come out to the stations. And we have a great peer support network through the International Association of Firefighters that works out really well that our EMS folks and us can use. It's goes both ways. So there's a lot of good things that are happening, at least with us, that guys have outlets, and we do have a lot of. It's a lot more than I thought. Use that stuff just so guys are reaching out and doing it. So
I feel like I can only speak for my experiences and maybe just the private EMS sector. I feel like we're failing in that department. I think we just leave it up to people. I'm curious to get your opinion on this. So I was actually listening to, this is the episode that we pushed out last week, if you're watching this now, and it was with Dr. Joy Hutchinson that Craig did. So in that interview, she brings up the fact that it's almost, do we force people in EMS, firefighters, medics, whatever, do we force them to go through these periodic mental health checks? I know how some people view that. They're like, I don't want to talk about it. I kind of just want to get through it and I can deal with it on my own. But what if this process catches somebody that is struggling with something, So what do you think? Should it be a voluntary thing, or would you be open to something that's
So
mandatory?
I think, I don't know. So here's what we do. So we have this thing called Frontline Mobile Health that we do, and we do these character tests that you have to go through and answer these questions. And Matt, I'm not going to lie to you. I've never answered these things truthful until this last year. I actually sat down and answered all the questions and was like, you know what? I'm going to be honest with this stuff. It's the same thing I used to do in the military too. You never answered truthfully because you always thought that they were going to, throw you in a mental institution or send you to some therapy or something that you didn't want to go to. So I answered them pretty truthful. And it was kind of, when I went in to talk to the doc, she asked me, she said, so do you have any depressive feelings? I was like, no, not at all. And she's like, well, you answered some questions here and there. And she's like, I'm not worried about anything, but it kind of opened my eyes up to some things. Like, so I kind of, you know, ask some questions and talk to her about some things. And not that I'm in therapy, but it just definitely opened my eyes up to a few things that, some mental health issues that I might be having. Like, one of the things was, I compartmentalize calls. Like I hide
Yep.
things away, which I think 99% of us in the fire service and the EMS field do that. I know you have. I mean, how long you been a supervisor for? I mean, I know that you do that stuff. We
Mm-hmm.
all know we do it. But it's just the nature of what we do. I mean, because you think about it, and especially with the EMS side of things, at least at the firehouse, I get to go back and go sit down and have a cup of coffee and, drink a soda or something. You guys go to the next call. Like, I mean, you get,
It's just,
that's the one thing, the EMS
yeah.
world, it's just nonstop. And before you know it, you've buried it away because you're dealing with something else. And I think that's, you know, uh, the mandatory, man, I think yes and no. I think everybody in the EMS field and the fire service should have a mandatory yearly physical. And that yearly physical should have some mental health component to it, whatever that might be. The problem, Matt, is that it's like I told you in the beginning of this. I mean, if it's an A, B, C, D question type thing for 30 questions, guys and gals are going to lie. They're not going to tell the truth because they're afraid that
They're gonna lose their
somebody.
job or something like that.
Exactly. And that's nothing, I think on my side, where we're working for a city and we're civil servants, we're more protected. We're like, I mean, who says Acadian says, man, this guy is crazy. We don't need him around. I would be scared of that. You know what I'm saying?
Mm-hmm. No, I completely agree. I think if it was like third party and it didn't affect
Yeah.
like your company or whatever, like they had no say in it other than, hey, you just gotta show proof that you did it. That's it. We
Yep.
don't care
I,
what gets
I think it,
discussed.
I think it'd be good. Yeah, I mean, I think everybody gets scared. It's kind of like even now, if the city of Fort Worth brought a survey like that to me, if it came from the city, I'd be like, nah, I'm not doing that. That's not happening. So, yeah,
No, I totally get it.
yeah,
And you compartmentalize the calls, and like you said, it's so fast paced that you don't have time to sit there and reflect on what you messed up on, what you could have done better, or even just process some of the things that you saw or witnessed. Um, but I think that the world has a way of bringing that stuff up eventually. Like you can push it down subconsciously as much as you want, but something at some point is going to it's going to fester and
hmm
it's going to come to the surface. So I I don't know if you've ever had this, and honestly, this is going to be the first time that I talk about it on here. Um, the paramedic, if she watches this, I won't name any names. She'll know what I'm talking about. Um, I kind of did that for years, where I compartmentalized a call. And the thing is, I drive by this place every single day on my way to work.
yeah,
So I get daily reminders of where this call happened. And you start thinking to yourself, did I do something wrong in this call? Is that why it keeps getting brought up? Um, and you try to shove it down. I go a few days or a few weeks, months without ever thinking about it, and then it comes back up again. And did this for 14 years? Yeah, 14 or 15 years, something like that. So this is a long time this was going on. And I bring all this to say that I deal with this one call for so long, and I push it down. I don't ever deal with it. And I'm talking to this paramedic, and she's a brand new paramedic. I'm talking about certain aspects of this call, and she's asking me questions about said call,
hmm
things that I haven't mentioned. And I'm like, yeah, that's where this was. And you would never believe this, but I'm good friends with this paramedic now. I was before I found this out. She was there, and she knew the patient that I was talking about, and she was able to give me feedback on what happened after the call, beyond the response, if I may.
Yeah.
And that was like after I had that conversation with her, I was like, that's the closure that I needed. And I feel so much better about it ever since that.
Hmm.
I bring all that up to say that as a paramedic, you push these things deep down and you never deal with it. Eventually, it's going to come to a head, and you're
Oh
going
yeah.
to have to deal with it eventually. So, long story short, that's what I'm trying to say.
Yeah. Yeah. So you're asking if I've had to do that
Yeah,
or
yeah,
had? Yeah.
essentially.
Oh,
If you
100%.
if you had something similar,
So, yeah, I mean, there's been, man, there's been a couple calls. I can give you one when we were in Hattiesburg and then one here in Fort Worth. We, South 49, if anybody knows 49 coming out of South Hattiesburg, there's in between Camp Shelby and 98, it's nothing but pine trees. And
yep,
people tear out and they go to the Gulf Coast and gamble all night. Then they come home driving drunk through there. I made a call on Rescue 1 with Engine 3 one night where we had a car with 4 people in it that went about 75 miles an hour into those pine trees heading north, and it shredded the car and just shredded these people. I mean, it was horrific. And I had a rookie on there's a rookie on Engine 3. And I mean, there's literally, there's like limbs hanging in trees, and there's a, decapitated lady in a car, and it's just horrible stuff. And this kid just like, hey, I could just see him. He's just in a state of shock. And I was like, hey, at some point, you've got to put this aside and you have to deal with the call. Like, I need you to kind of get involved here. And he kind of started helping. We started checking for people. And I said, of course, there was all 4 of them were passed away. They were all deceased. But, that was when I started knowing, like, man, if I can deal with this poor kid, it's his first major call. And that's kind of one of those things where that's came back up how I handled that with him, because we didn't really checked on him after that. Everybody just kind of went to bed. And then it was kind of the next shift. It's like, hey, are you okay? And it's funny. He came to me probably 3-4 years later, and he's a firefighter somewhere else now. And he was like, man, that really messed with me bad. I was like, well, man, 15, 20 years ago, man, we didn't care about this stuff. We didn't talk about uh, debriefings and things like this. I mean, mental health wasn't a big thing that we talked about. And then, that kind of bugs me sometimes where we didn't talk about that more.
mm-hmm.
Should have known better. But at the same time, I mean, just not something like we talked about in the beginning, something that we discussed, it didn't really bother me. Yeah. It bothered me more than it bothered this kid 4 years later, if that makes sense. It's still bothering him. So, and then, wasn't 2 Christmases ago here. It'll be 3 this Christmas. I was working overtime on C shift. We had an apartment fire here in Fort Worth, and, we were doing a search, and I missed 2 bodies. I went on a right-hand pattern search. My captain went on a left. One guy with a lady she was pretty burnt up. She was in some ashes and stuff like that. Like the ceiling had came down on top of her, and I just missed her. Pretty much crawled right over. And then there's a gentleman in a bathtub underneath the water that I just missed. That bothers me quite a bit. And it's one of those things that'll come up, and I'll be like, man, quit beating yourself up over it, or I'll talk to my captain about it, or talk to one of the guys. And, it's the same thing. But, those are probably 2 of the things that affect me the most in my fire service career. Now, there's countless things with the Marine Corps and just being overseas that are just, those are stories for another podcast sometimes. So, we got a lot of
Yeah.
those, but those are probably 2 of the ones that stick with me the most lately. So.
You bring up, that feeling of you missed something, you missed those 2 patients there.
Yeah.
I actually had a conversation recently with someone, and it was kind of, did I do something that inadvertently, not necessarily killed this patient, but did I do something that harmed this patient and negatively affected them? And my thing to them was, you did the best that you could with the circumstances that you were in,
Mm-hmm.
And you try to give advice out and stuff like that. And it's like, look, I don't do Monday quarterback stuff. I try to give you the best thing that I would do if I was put in that situation. But guess what? I wasn't in that situation. I wasn't crawling through a fire, so I would be not in the same headspace that you were in, you know?
Yeah.
So I respect that. But yeah, I try my best not to think in terms of, okay, did I do something that negatively affected everything? Those things just eat at you like a damn cancer.
Yeah, they do. Yeah, you're right.
It's hard to get over those things. And
Yeah.
it goes back to that call I just mentioned a minute ago. It's like I thought I had failed at things for years and dealt with that for years. And I say deal with it, but I didn't really deal with it. I kind of just went over the call multiple times every so often.
Yeah, and yeah, I think that's natural for us to do, because I think naturally, Matt, if you're in this business, whether it's fire, EMS, you want to naturally do better. Like you don't want to be horrible at this job. You want to be good at it. I mean, that's what we're here for. We're here to, whether it's I'm here to preserve property and save lives. You're here to save lives. That's what your job is. So we of course want to be the best we can at it. So.
Kind of bouncing off of that for just a second. How, after calls like this, how do you process those moments afterward? Do you do something? I know you go back to the firehouse and whatnot, but maybe like when you go home eventually, is there something that you do that gets away, shift your mindset in a different space, like a hobby or anything like that, to decompress?
Yeah, I mean, I enjoy fishing. I enjoy reading books. I try and get my mind off things. Matt, I'm going to be honest with you, man. I've always had a really good ability to kind of shut things off a little bit, and which is probably not the best thing in the world, because it's something that we're talking about not doing. But, it's going to the gym, working out, whether it's going for a jog, fishing, reading books. That's pretty much what I'll do. That's kind of what I do when I get home. I'm not going to lie, but there is times where we'll get off and we'll go have a couple drinks at 7:38 in the morning. That's happened numerous times, but that's more of a, that's camaraderie. A lot of people say that's the wrong thing to do, but sometimes it's beneficial to just sit there and chat about something for a couple hours,
And that to me is probably the most beneficial thing. Is like when we clear from calls, sometimes we'll see other crews at the hospitals and whatnot. So we'll kind of just chat and we'll go over the call, or even just talk about other things. I mean, most of the time it's complaining if you're in EMS.
Yeah.
And sometimes that just gets me off of that call even more quickly, and then I've already compartmentalized it, and I've shifted gears to the next call. Like I'm good.
Yeah. And, we do that around the fire station table. I think that's the one thing I love the most about the fire station and the life that we live there, and having our EMS folks there with us, is that when we do have those crazy messed up calls, we're all back there together. And I mean, you've been around a firehouse before. I mean, there's a lot of banter, and sometimes there's a very crude humor that gets done around, but that's kind of our way of dealing with it. Same thing in the EMS field. I mean, I've been on an ambulance before numerous times for a long time, and it's the same humor in the EMS field that is with us at the fire station table. So I think sometimes that humor and that kind of, man, you're just being just how we screw with each other is kind of, I think that helps. It really does in a way, because it's just kind of like, it's our way of kind of dealing with it, I think, is with humor. So
I brought Presley, for those out there, that's my daughter, on a kayak trip last weekend. We did it for our rotation, and I gave her the warning beforehand, because this would be my first time, or her first time with paramedics and EMTs and stuff like that. I was like, look, we're a different breed, okay? you're going to think they're weird. They laugh about weird things. They're going to talk about death and things that we really haven't subjected you to over the
Yeah.
years. So just be prepared for it. And afterwards, I asked her, I'm like, so what did you think about my coworker? She goes, yeah, they're weird. Y'all laugh about some weird things. I'm like,
Yeah. Well, that's how we deal
that's
with things. I mean, hey, that's good. We're getting her to where she doesn't want to be in this public service, so that's a good thing. Let's get her somewhere else, because that's, the same thing. It is what it is, and that's I think there's a lot of people that think that. I think there's a lot of people that think we're sick and twisted sometimes the way we act and talk, but it's like, all right, well, that's what you think, but you don't do my job. You don't. I mean, it is like, I mean, the
they
things that
don't
we have
know
to
until they
see.
know.
Yeah, yeah, 100%.
My wife has, I mean, we've been together for as long as I've been a
Nice.
paramedic.
Yeah.
And she still doesn't understand the humor and the conversations that we will all have with each other. It's
Yeah.
complete. She was like, y'all are some sick individuals. I'm like,
Yeah.
yeah,
Well,
but you know what? It's all of us. It's not just one.
yeah, it's but we're the people that you want showing up when you're having your worst day. So I mean, that's you know,
Yeah,
just as long as we're not
exactly.
talking like that in front of the patient's family and things like that.
Oh, absolutely.
That's always bad.
That's been one thing that always drives me crazy is when people start, like, I'm all about cutting jokes in front of the patient to kind of make them feel better and shit like that. But in terms of bringing our personalities out, I've always had an issue with that because I'm like, all right, not the time. I'm zoned in. I'm ready to focus on the patient care. I'm ADD, man. You get me on a tangent with whatever joke you're talking about, I can never refocus.
Hmm. Yeah.
And it's also unprofessional. I mean, that's the big thing.
Yeah. Yeah.
But I want to go back to something you brought up a second ago and just touch base on it for a second. And that was, you had that rookie who dealt with a critical call.
Yep.
I have tried in the past when we have like new hires or even like EMT students or paramedic students, it's so easy to run that DOA or that fatality or that patient that ends up dying after you get to the hospital, whatever the case is. It's so easy for us to go through that, like you and I, and we come out of it and we're just normal, we're joking around, we're going, and I mean, we can see the most disgusting thing ever and then go eat immediately after,
Yeah, 100%. Yeah.
And it's so easy to forget about that newbie, the new person on the block, So I've tried over the years. I haven't always been successful, but it's like, hey, are you okay? Like, this is your first dead body.
Yeah.
It's different for everybody. And they're like, no, I'm cool. It's weird, but it's cool. I'm like, all right, here's the kicker. You may not feel anything now, but if for some reason tomorrow, the next day, next week, whatever the case is, if you're kind of messed up about it, reach out to me.
100%.
And that's kind of the thing that I would, if you're a paramedic or EMT firefighter, I would say try to get in that habit. I'm not great at it. I'm bad about just going to the next call and not even asking people, but I try to do that to the best of my ability.
Well,
it's different for the new people.
Yeah, I 100% agree. And I've had that talk with our niece already. Here, she works here on the fire department with me now.
Yeah.
Same shift. She's at a station across town from me. I know that I know that our sisters probably had that chat with her and her dad because I mean, they both had lengthy experiences in the first responder field and just with being a nurse but that's one thing I've worried about with her and just letting her know, hey, look, you've got all these outlets that you can use because she's going to see it. And I think it's our duty now, senior people. I think it's our job to make sure that we check up on them and make sure that we are I'm not like I did with that new guy where it just I kind of pushed him off, not pushed him off, but said, "Hey man, I need you in the game." And then it kind of just lost track of him, but I think it's something that we could do a better job of, which I think the fire service and fire-based EMS has gotten better with doing that now. I can't speak for the private sector. I know there's just so many outlets out there now. It's kind of hard not to with, it seems like there's a million different 800 numbers you can call to get counseling or talk to somebody. And I feel like if you're not reaching out, then it's almost, I don't like to say your own fault, but it's like, come on,
there's options.
Exactly. And I'm sure you guys have them with Acadian because everybody's got them now. It seems like.
Yep.
So.
Yep. No, we have our own little program that if we know that they went through a difficult call, it's like, hey, look, you don't have to tell me anything. You don't have to tell me whatever. Here's the card. Here's the number. Call that number if you feel any type of way about it. You don't have to come to me about it. You can if you want to. I'm here, but this number is for you.
Yeah,
and
that's
you
awesome.
don't have to tell me. You don't have to tell me if you use it or not. I don't want to say I don't care, but it's like you don't have to come to me.
Yeah, that's how it is here. Everything here is 100% confidential. There's, of course, there's always a select few people that know because we actually pay, like the union will pay for your trip up to whatever facility you go to, and then, our healthcare trust covers all that stuff. And the city's been they're great too with all the resources that they throw down range to for us. So,
shifting gears for just a second. So you're a Navy corpsman and then a firefighter.
Yep.
If you had to go back and do it all over again, you had to choose. You can only choose between the two. You would choose Navy corpsman
over being
a firefighter. Like if you could only have one.
Well, if I had to choose one where I couldn't have done the other, I would have been a firefighter just because I grew up around it. My father, I absolutely, from the time I've always wanted to be a firefighter, just be just like my old man. So I would have done that. I am super glad that I chose the route of being a Navy corpsman, especially at that time in my life. I think the military is probably the best thing for me when I was 17 years old because I went into the Navy very early. I needed that in my life to get back on track. So, and it was a super easy transition going from the military into the fire service because we are a paramilitary organization, wearing uniforms, being at work on time, maintaining, good posture, good physical fitness standards. So I think it was an easy thing for me to do going from the military to the fire service.
I feel like it's very similar in a lot of ways.
I 100% agree. I think it's minus we're not carrying weapons. But that's about the only difference. But it's the same. It's the same camaraderie. It's the same banter around the fire station. It is when we were around the units. So I think it's very, very similar in a lot of things.
Mm-hmm. And then I want to kind of wrap up this episode with a little discussion about leadership and to kind of tie in the mental health aspect that we've kind of been bringing to the forefront with this episode. What do you think a leader can do to better serve the people that he's leading in terms of noticing that they're burned out or that they're suffering on their shifts, whether that be just poor work conditions or even just suffering with a little bit of the mental health aspect of it. And this is kind of a broad question, so we can go in multiple different ways here. But what does leadership look like to you in regards to all those things?
Well, I think the big thing with leadership, but when it comes down to mental health and just when it comes down to being a good superior to your subordinates is, and mind you now I'm just a firefighter. I have a leadership role in the union, but being in a leadership position before in the Navy and when I was in Hattiesburg, I think it's just noticing when there's something deficient in your crew or the people working under you, maybe not jump down their throats so quick. Let's get to the bottom of it. Because most people, if you know that your people that are working for you do a good job consistently, and all of a sudden you have a guy that comes in, it's kind of like I talked to you in the beginning. If I come in and I'm not being loud, if I'm not, messing with somebody and I'm just super quiet, guys will be like, man, what's wrong with this guy? There's been a couple times where I've been kind of down on myself, and I think that's a big thing. I think if you notice deficiencies instead of just jumping down their throat, who knows what they've got going on at the house? Maybe it is that call that they had last shift. There's so many people that are leaders that immediately want to be like, hey, well, what the heck is going on with you? Why are you 5 minutes late? Hey, why is your uniform not tucked in? Why are you not, why are you so tired? Who knows what's going on, man, with that person? I think that that's probably the number one thing that leaders can do is not being so quick to jump the gun and just, hey, ask some simple questions, like, I mean, if you've got a 19-year-old, 20-year-old kid, what have they experienced in life? Maybe they had lost a loved one at the house, or maybe, hey, their girlfriend or boyfriend just broke up with them. They've never experienced that before. And that just happened. Now they're at work taking care of patients. I mean, this is stuff that I think that we need to do. You'd want to know. I've had things like that happen to me before when I was in a leadership position, and I felt horrible, crawling getting in, yelling at somebody, and it's like, oh man, then you find out, oh blah, oh man, I'm sorry to hear that. I wish you would have told me that from the beginning. Now I feel horrible. So,
Mm-hmm.
um, that's what I would give leaders. I would tell them, hey, look, instead of jumping the gun, just get to the bottom of things first. Now, sometimes if you've got this Yahoo that's showing up late 10 shifts in a row, then yeah, he's probably deficient. It's probably time for him to find another job.
It's
But
time to have a conversation.
yeah. So, but there's just we're just so quick to jump the. And look, I'm guilty of it now with my even with Shara, my wife. It's like, I don't know what kind of day she had at work. And sometimes I'm like, hey, what the heck's wrong with you? It's like, I don't think about what's going on with her. Or, one of the kids or something like that calls me and they've got a problem. And sometimes I'm real quick to just jump and say, well, you should do this, when I don't really get to the bottom of what's really bothering them. So,
I think, and this is kind of similar to what you were just discussing. I think a good leader just treat your people like human beings. Now
100%.
you're gonna have a knuckleheads out there that you're gonna tell them 20 times how to do something, and sometimes people just are not right for the job. Not everybody can be an EMT, a firefighter, or a paramedic. It's just, if everybody could, then everybody would. We wouldn't have staffing issues across the nation if everybody could do this job. So I try my best to treat everybody like a human being.
Mhm.
And like you said, you don't know what they're going through. And when you have that one employee that you can always count on, and then all of a sudden you start seeing little issues here and there, and it's like, hey, listen, this is just a conversation. You're not in trouble or anything like that, but I'm noticing some things with you. You're showing up late now. You were never late before. And then maybe some of your reports are not being completed on time. What is going on? And I think
Well,
just having simple conversations with people will give you the answers that you need.
yeah, and Matt, let's talk about real quick. I mean, just think about how young our leaders are getting. I mean, I know here in the fire service, at least in Fort Worth, our leaders on these engine companies, and they keep getting younger and younger and younger. So I think that this goes for the senior guys and gals out there too that are riding these ambulances. Like, I mean, it's our job as senior people to know also when people are being deficient, because it's not just us. You as a leader, you're a supervisor. Hey, I know who you are. If I do the same thing for you, if I work for you and be like, hey, Matt, what's going on? What's wrong with you today? I think treating everybody as a family and treating each other, because we are a family. I mean, 100% we are. I don't care if you're working for a private ambulance service or you're working for fire-based EMS or a firefighter or in the military. We're all a family. And I feel if you don't believe that, you're in the business for the wrong thing. I mean, we're here to take care of each other and take care of our patients and the people we serve. So
So I was burned out for a very, very long time.
Yeah.
Hated EMS, hated being a paramedic. I could have literally done anything else in my life and been happier. And a lot of that was affected by COVID and personal stuff and stuff like that. To me, it like it was like every day. As soon as 6 o'clock hit, I was gone. There was no me staying around talking with my friends or coworkers, whatever, and just being that, like you said, a family. Didn't want to do anything outside of work with them. If they asked me, I'm like, yeah, I'm good. I spend enough time with y'all at work. I'm good. I want no part of it. And I had a mindset change a few years ago when I became a supervisor, and that was, maybe that's what's missing not only in my life, but maybe everybody else's that I work with is let's do stuff outside of work. Let's when we do those things, let's not discuss work. Let's just BS with each other and have a good time, you know?
Yeah. Yeah.
Because these people, you spend how much of your time with them? A third of your life, at least, a half of your life with these people, more than your family. So at some point, they become your family. And like you said, you guys start treating them like that and just having conversations with them. And yeah, that was a huge mindset change for me and something that I focused on as as someone in a leadership role is to bring people together and let's stick together.
Yeah. And it's, I think it's easier and like burnout. I don't get burnt out with going to the fire station. I love being a fireman. There's not a day I goes by I don't enjoy wanting to go to work. Where I get burnt out is how it is a new SOP or it's just some crazy thing that comes down from admin sometimes, which our administration honestly is very hands off with us here. They really don't interfere with us much, but I talking to some of the EMS folks that came over from MedStar and it's like people in the EMS field and just working for AAA. I mean, it's the every day sitting in an ambulance, sitting in a gas station parking lot. And I think, I remember there's guys at AAA that were doing this for 25 years. It's you know what I'm saying? And like, I don't see how y'all do that sometimes. You know what I'm saying? And like, I think the burnout with EMS, obviously we've talked about this and I think I might have I watched one of your podcasts. Did you guys do one on the turnover in EMS and how you guys have had so many people leaving? Or is that something else I read?
Yes. Nope. That's it.
Okay. You guys,
the staffing crisis in EMS.
Oh, dude, it's 100%. And the thing is that firefighters, they don't leave. I mean, we stay. I mean, we every once in a while you get some guys leaving, but EMS, it's like, I think it's one of the biggest crises we have, like you were just saying, in the United States right now, because we're having trouble keeping paramedics here. Nobody wants to do this anymore, it seems like, So that's why we got to get creative with pay. We've got to get creative with I think how we treat EMS and EMS in general. So
yeah, that is, we spent like an hour talking about that. I could talk about that all day. It's like there's not one real solution to that. There's so many different solutions, and it's all about having a leader that will go beyond all that and start enacting all those, and
it costs
those solutions. And it costs money.
And they don't want to put money into us. That's the one thing they don't want to do. They don't, and that goes for our side, your side, anybody. It's just, hey, everybody wants to treat public servants like we're all like, hey, we're the best thing since sliced bread. But at the same time, they don't want to put the money into us. We've been operating with the same budgets for 20, 30 years, so just the way it is. But, we keep doing the job. So
amen to that. What else can we do,
Yeah, that's it. That's all we can do.
Well, sir, I appreciate you joining me for
100%.
This episode, man. I'm not gonna lie, I had a list of questions to ask you, and I don't think I asked like half of them just because we got stuck on some other things, and I prefer it that way, anyways.
Yeah.
So thank you for exploring some of those things of the calls that you deal with and whatnot. I really do appreciate it.
Yeah, it's been awesome. Maybe come on again next time.
Absolutely. I do have one more question though.
Yeah, what's up, man?
So you want to become a firefighter, you sign up, you go through your training, all right? At what point do you learn to block driveways? Is it during the courses, or is it?
Yeah, that's awesome. It's great because it's funny because I still notice that sometimes. Like I'll park halfway down the block when I'm driving the truck sometimes, and I'm like, they're like, why are you parking this far? Because I don't want to listen to y'all complain about me blocking the driveway or the pathway going up there. But it's the same thing because I work on a truck company. We're always telling these engine bubbas, hey, they never leave the front of the house open for the truck company. But yeah, it's I don't know what it is with firemen blocking driveways for the EMS crews, but they sure don't like that crap. That's for sure.
We had this guy Rick. He does fire line medic stuff. And I asked him that question at the very end. I'm like, so do y'all block the entire forest or just just part of it? How does that work?
It's funny.
Yeah.
That's good stuff.
Love the firefighters, humor. You know. What would we do without y'all, you know?
Hey, who would pick up all these people for you? That's the thing.
That
lift helps. So
hey, live with your firefighter, not your back, you know?
Yeah, there you go. Hey, I like it.
But yeah, man, thanks again for coming on here.
Yeah, of course. Yeah, it's been a pleasure, brother.
All right, guys. Well, if you've enjoyed this episode, make sure you hit that like, subscribe button. Help us grow this channel. And yeah, we appreciate y'all joining us for this episode, and we will catch y'all next week on another one. See y'all later.
Awesome.